I am Dr. Youngnam Kim, a specialist in internal medicine at the Jaisohn Medical Center. The most important aspect of diabetes treatment is exercise therapy. Why do we need to exercise? Exercise consumes sugar and energy, helping to control weight. It also lowers cholesterol, reducing the burden on the heart and brain. Therefore, exercise is essential. As you know, there are two types of exercise. The first is aerobic exercise, that is oxidation exercise. When exercising, you supply oxygen through breathing to meet the energy demands of the exercise. A prime example is walking. Walking, as you know, is easily accessible anywhere outdoors, around your home, or at a park. Ideally, aim for 30 minutes a day, 5 times a week. Exercise is necessary not only to burn calories, but also because 30 minutes of daily exercise improves insulin sensitivity, as I mentioned earlier. This leads to better blood sugar control. Therefore, especially for older people, it's advisable to check your blood sugar before exercise. Avoid exercise if your blood sugar is too low or too high. For example, avoid exercise if your blood sugar is below 70 or above 250. Ideally, exercise should be done 30 minutes to an hour after meals. People with long-standing diabetes may experience neuropathy in their feet, losing sensation. Always be careful to avoid falls and foot injuries. While aiming for 30 minutes a day, 5 times a week is good, you can also split up your exercise. For example, 3 10-minute sessions are equivalent to 1 30-minute session. So try to walk as much as possible. Once you have good weight and blood sugar control from aerobic exercise, the next step is anaerobic exercise. Anaerobic exercise is muscle exercise that doesn't require oxygen supply. For example, weightlifting or a 100-meter sprint. These are intense, short bursts of exercise, around 1 minute to 90 seconds that strengthen muscles and help lower blood sugar. However, avoid overexertion during anaerobic exercise. In other words, for aerobic exercise, walking is important, but so are cycling, swimming, hiking, and golf. These are appropriate levels of aerobic exercise. Something important to note: as we age, our muscle mass naturally decreases. After age 40, muscle mass decreases by about 3% annually. To prevent this muscle loss, activities like weight training and stretching are necessary. Therefore, it's best to start with aerobic exercise to manage weight, and then incorporate anaerobic exercise to prevent muscle loss and maintain health. That concludes my remarks on exercise therapy.